Hello, my name is Gio Lozano, and in this video I will be demonstrating how to take blood pressure. Before taking the patient's blood pressure, make sure the patient has been resting and has not had caffeine or nicotine within the last 30 to 60 minutes. As demonstrated in the video, make sure the patient's back is supported, feet are flat on the floor, uncrossed, and the arm is elevated to heart level. To ensure proper cuff size, make sure patient's arm covers 80% of bladder. Once ensured, find the artery line on the cuff and locate brachial artery. The brachial artery has been located. It is time to place the cuff on the arm. When placing cuff on the arm, remember to make sure that the artery line falls on the artery. Once artery line has been placed, wrap cuff around the arm nice and snug, then use 2-finger rule to make sure the cuff is not too tight and allows for proper placement of the stethoscope. When using the stethoscope, make sure the ear prongs are facing forward and not backward so that you are able to hear the Korokov sounds. After placing stethoscope with proper orientation, grab the bell of the stethoscope, hold between 2 fingers, and make sure that the bell is facing down, and when placing on the brachial artery, do not place under the cuff. The Korokov sound is named after the Russian physician Nikolai Korokov. It consists of 5 phases. 1 is a clear tapping sound, signaling a systolic pressure, followed by swishing noise with crisper and louder tapping, leading to a blowing sound, and silence that signals diastolic pressure. Systolic pressure is the highest pressure during contraction of the heart, while diastolic pressure is the pressure in the arteries between heartbeats. When taking blood pressure, tighten valve and inflate bladder to 20 millimeters of mercury above first Korokov sound, or 180 to 220 millimeters of mercury. This can usually depend on patient size. After inflated, loosen valve to release at a rate of 2 to 5 millimeters of mercury per second. First Korokov sound to be heard and recorded is a systolic pressure, and last Korokov sound to be heard and recorded is a diastolic pressure. During this assessment, patient's blood pressure read out to 120/80, and according to the blood pressure chart at the end of this video, he was in the pre-hypertensive state. For hearing the last Korokov sound, loosen the valve in order to release the rest of the bladder. After taking blood pressure, make sure to release the rest of the air from the cuff. Loosen, take off patient, and allow patient to rest 5 minutes before taking the next reading. This graph is to show the different categories of blood pressure: normal, pre-hypertensive, hypertensive stage 1, hypertensive stage 2, and hypertensive emergency.